Lebanon VA Medical Center has implemented a short-stay joint replacement surgery program that helps veterans spend minimal time in the hospital for knee replacements. Spearheading this project is Dr. Kate Desroth, orthopedic surgeon who leads the team.
This was a collaborative effort between anesthesia, pharmacy, and physical therapy. We used special blocks before the surgery to help control pain. Then I gave additional pain blocks during the surgery, and we used a combination of non-narcotic pain medication after the surgery to help get the veterans up and moving. This empowered them to be engaged in their physical therapy. They felt less like a patient in the hospital and more like an athlete in training or someone engaged in their therapy.
U.S. Navy veteran Steve Roman took advantage of this program and chose to have his knee replaced by Lebanon VA Medical Center. Here's Mr. Roman speaking about his surgery, the care he received here, and his advice for fellow veterans.
Before my knee replacement, I had to come every 6 months to get an injection in my knee, which, it worked okay for a while, but then it stopped working. So it was just constant pain in my knee. I couldn't hardly walk stairs. It was difficult to do any long distance walking at all. And it was making my job tougher and tougher. My stay here was great. I had no problems, no issues. Everyone was very attentive, very nice, pleasant. I spent the night after I had so it was just one night that I was here and I left the next day. The benefit for me is I was able to be at home. And actually the VA coordinated with physical therapy right close to my house, and it was just a lot nicer to actually be at home in my own bed, and I just feel I could recover better being at home than staying in the hospital. I mean, I'm home. I have animals, and my wife was home, so it was really, really good. Now, I mean, my surgery was March 25th or 26th, and I took pretty much 2 months off of work, and I've been back to work since June, and I feel great. I mean, it's continuing to heal, and I don't have the throbbing, achy pain that I used to have every single day when I, during work, out of work. I can climb the stairs at work now, and my job requires me to do a lot of walking throughout the day, and I do it with no problems at all now. Stop waiting. The best thing to do is to go ahead and have it done. The longer you wait, the more pain you're going to be in. I was in pain for quite a few years, and if I could have had it done sooner, I would have. If you need your knee replaced, don't wait. Get it done and come here to the Lebanon VA, and like I say, Dr. Desroth and her team are top of their game. They're absolutely fantastic.